Selective internal radiation therapy, or SIRT, is a treatment for the type of liver tumors that cannot be removed with surgery. Some doctors may also refer to SIRT by other names, such as radioembolization or Y90 therapy. SIRT is performed by a doctor injecting millions of tiny radiation-emitting beads, called microspheres, into the blood vessels of the liver. These microspheres are about 1/3 the diameter of a strand of human hair, small and light enough to be carried by the liver's bloodstream to reach and become permanently implanted in the tumor's tiny blood vessels. SIRT Spheres Y90 resin microspheres are the most common type of SIRT microspheres used for this procedure and have the greatest number of worldwide studies showing their results for fighting cancer in the liver. The SIRT procedure is performed by a doctor using a soft, flexible tube called a catheter. This catheter is inserted through a small incision in the groin and guided through a blood vessel called the femoral artery directly into the liver's blood vessels. The doctor uses a form of X-ray to see that the catheter is going to the correct location within the liver. The SIRT Spheres Y90 resin microspheres are then injected through the catheter and are carried within the liver's bloodstream to where they finally lodge in the very small vessels around the tumor. Once the SIRT Spheres Y90 resin microspheres lodge in the very small tumor vessels, they give off cancer-killing radiation, but it's a particular type of radiation that only travels a few millimeters in human tissue. This allows the cancer cells to get the radiation while the majority of the surrounding healthy liver tissue is spared. The action of the radiation destroys the cancer cells, causing the tumors to shrink. Most of the therapeutic radiation is delivered within 2 weeks and then decreases to levels similar to natural radiation sources that surround us all on a daily basis. Clinical studies show that when used in combination with chemotherapy, SIRT Spheres Y90 resin microspheres can shrink patients' liver tumors more than chemotherapy alone, improve quality of life, and help patients live longer. For a small number of patients, treatment can lead to the tumors shrinking enough that they may then be removed with surgery. Almost all treatments produce unwanted side effects. Some side effects can be minor, making you feel uncomfortable, but a small number can be serious. Everyone is different in how they may react to a specific treatment. Following SIRT, some patients experience abdominal pain and/or nausea, which normally subside after a short time and/or with routine medication. Patients may also develop a mild fever that may last for up to a week and fatigue which may last for several weeks. As a precaution, you may receive additional medications such as painkillers, anti-inflammatory, anti-nausea, and anti-ulcer drugs with your treatment, with the aim of preventing or minimizing these side effects. As with any cancer treatment, you should talk with your doctor to determine if SIRT Spheres Y90 resin microspheres are an appropriate treatment for you.